This is Dr. Michael Tapper from Lenox Hill Hospital and the Northwell Hofstra School of Medicine, speaking on behalf of an infectious disease advisor. And I'm here today to have the opportunity at the IDSA annual meeting, or IDWeek, to interview Lisa Saiman, who spoke earlier today as the meeting is finishing about some very interesting research about the efficacy of mandatory vaccination programs. For those of you who don't know, many states and many healthcare systems in recent years have adopted mandatory vaccination programs for influenza in an attempt, largely successful where it's been taking place, to boost immunization rates. But what you really haven't had is good data looking at the impact of those mandatory immunization requirements. So Lisa actually has some data. I'm very excited to hear her represent the data that she presented earlier at this meeting.
Hi, Mike. So I just wanted to correct one thing. New York State did something very clever. They're not mandating vaccination, they're mandating a mask use of unvaccinated healthcare workers when they're in patient care areas. So the burden of having to don a mask during the flu season actually had the very beneficial impact of having people get vaccinated in efforts to avoid having to wear the mask. So as you alluded to, I work at NewYork-Presbyterian Hospital. We have 5 acute care campuses in Manhattan, employ about 29,000 healthcare workers, and under the New York mandate, the vaccination rate has exceeded 90% now for the 3 years that that's been in place.
Well, that's great data. And when I said immunization mandate, I was thinking across the picture of the country. New York State was actually the first state to come up with a mandate of any sort, masking versus immunization. Other healthcare systems in other parts of the country have also adopted basically mandates for the same thing, in some cases allowing exceptions for moral beliefs, or some cases allowing exceptions for medical contraindications. But as you point out, most healthcare workers, rather than wearing a respirator, or rather than wearing a surgical mask for the duration of the flu season, have elected to get immunization, and it's had a salutary benefit. But I'm particularly interested on the outcomes of all this immunization that we are now seeing going on in healthcare systems. And that was the data that you presented earlier today.
Right. So we looked at visits to our workforce health and safety by healthcare workers during 3 influenza seasons. 1 was pre-mandate and then 2 were post-mandate. And we looked at the number of individuals who came to workforce health and safety with acute respiratory infection or influenza-like illness. And we also looked at the number of individuals who had laboratory-confirmed influenza. And we were also interested in the burden of other respiratory viruses, because obviously ill healthcare workers pose a risk to our patients. So what we found was that in the years that the mandate were in place, the number of workers that came to workforce health and safety with acute respiratory infection and influenza-like illness decreased, and the number of actual cases of influenza decreased. I should remind you that we had over 1,200 visits with ILI and ARI during that time period, of which nearly half, 49%, actually were laboratory-confirmed influenza. Mm-hmm. We also noted, although it wasn't statistically significant, that a lower proportion of vaccinated workers, 47%, had laboratory-confirmed influenza compared to unvaccinated workers, 52% of those people. So again, a suggestion that it is effective in the environment that we work in. Interestingly, and I think you would be surprised by this, we found that coronavirus was the next most common respiratory infection. That was true over all 3 seasons.
I was surprised by that. I would have guessed something else.
Yeah, you would have probably guessed rhinoenterus.
I would have guessed rhinoenterus, exactly.
Yeah, I would have too. So obviously there were limitations. How generalizable is our setting? We don't really know compliance with our clearance policies. People do work sick, unfortunately, so we're not completely sure about that. And now we're working on looking at the impact on other outcomes, and that would be sick days, as well as healthcare-associated influenza in our patients.
Well, this is, really interesting data, and now that these mandates are out there and the CDC has looked at the overall response across healthcare workers and in general, the immunization rates where there are mandates have certainly gone up, very much as what you saw at Columbia-Presbyterian and all its affiliates. So I think it's going to be really interesting to track this, see what other things like coronaviruses, as we now have these multiplex assays that are more widely available, if not in the community, at least in academic centers, to see what really, if anything, emerges to replace influenza. And whether or not we're going to continue to see the benefits that you've shown so nicely in this study. This is very exciting work, and I hope you'll keep doing it from year to year.
Yeah, we really are intending to do that.
That's great. Thanks so much for your time today.
Thank you.